fantastic work. We're going to open it up for Q&A, and I think we'll take a round of 3 questions and have quick responses and then go right back to our audience. So any questions? I see number 1 is up. Let's go. We have 15 minutes to do this.
Okay, thank you. Great presentation. I'm Bolade. I'm from Benin, and I'm a postdoc researcher at the University of Cape Town. And I have some questions. The first, on the last presentation, you talk about synergistic effect of the SAVA, and I have a question on that. I couldn't see, or maybe I missed this part, where you look at an interaction between different SAVA. You sum up the number of SAVA, and you look at how they are associated with the outcomes. I would suggest that you take a more powerful approach to look at that, looking at interaction, and then looking at potentially the attributable proportion of interaction leading to those outcomes. Yeah, and then the second question, sorry, is about for the first presentation. Yeah, the first presentation. I have some issue with, I'm sorry, with having lifetime sexual partnership as outcomes for HIV risk behaviors. In the data collections, is there, didn't you collect data on past 12 months outcomes? My worry is about adolescents being able to remember exactly how many partners they had in the last time, and also for temporal precedent issues. Thank you.
Okay. Number 3 was up, so then we'll move over to number 2.
Thank you very much. My name is Seppo. I'm from Zambia. My question is for Candice. So one of the conclusions from your study was that the boys that experienced some form of violence were more likely to perpetrate more violence. And so my question is 2 parts. The first one is, were you able to differentiate and pinpoint that the majority of the boys who were victimized are the ones that later perpetrated the violence? And if yes, was it like a before and after, like the victim first and then they went later on to do the violence? My second part of the question is, from the data that you collected, did you or would you be able to become a bit more specific to see that if the type of violence that they experienced would then lead them to perform the same type of violence, if it's physical to physical and so on? Thanks.
All right. Thank you. So let's have quick responses to those, and I'll come over to you, Magda.
It's on. Okay. Yeah, so we had a 1.69 times odds increase with each additional SAVA condition. So I'm not sure if that addresses the question of looking at the synergistic effect. I hope that answers your question.
You had a quick question about our recall period. We did collect lifetime partnerships because these were really young kids. So, you know, at our follow-up, the average age was only 16 still, right? They were 13 to 19. So I think their recall of how many people they had been with was fairly good. But we didn't specify last year, and we chose the outcomes based on what in the literature has been most proximately and most consistently associated with HIV risk transmission.
Okay, thank you. I hope I remember both parts of your question. So the first, if I remember correctly, was about the timing. You know, is it that this week's experience of violence means that this next interaction would you'd perpetrate in the next interaction? Is that correct?
I think it's bidirectional. Did it happen at the same time?
Or did it happen at the same time? Okay. So I do want to point out that this is a very, we're still collecting data, and it is a very preliminary analysis that we did, and it was a very quick snapshot. And that direction, I think, with more sophisticated analysis later on, and Rachel can help, she helps me on this, we work together on the study, and I think you can help answer that part of the question more. But as to the type of violence, I think that's something we'll definitely look into going forward as we get more of the data coming in.
Just to expand on that, we did try some lags, meaning like what you reported the week before versus the experiences of perpetrating this week. So if, you know, last week, not this week, but last week I was a victim, did I perpetrate more violence this week? To try and separate that out, because there is a worry that, you know, in one interaction, you're both a victim and a perpetrator. There's a lot of bidirectional violence, and that's really hard to sort out. And so we have looked at that. And if you experience violence, you know, in the weeks before, then in this last 24 hours, you're more likely to perpetrate. So we have tried to get at that. And we have tried in very preliminary analyses, as Candice mentions, because this is ongoing. We're still collecting data. We have looked at whether sexual violence victimization results in more sexual violence perpetration and so forth. And honestly, the results are pretty strong no matter which kind. There's a little bit of a bump, you're right, like in sexual violence, victimization seems to increase sexual violence perpetration a bit more than, say, physical victimization. But, you know, it's evolving, so we'll see how the data, you know, come out at the very end. But right now, there is a little bit there. But honestly, the associations, regardless of type of violence, even emotional violence that you're experiencing, is pretty profound on your perpetration of any kind of violence in the next, you know, week.
Magda, and then we'll go to number 1 and then number 3.
Hi, thank you very much. I'm Jenny Renju from the Global Fund. Great presentations, and I think my question goes to both Candice and to Rachel. And it's really thinking through how we can break this cycle of violence, and I think both of you are kind of showing that this is all happening. It's a cyclical relationship. And did you capture who was inflicting the violence on the then perpetrators of violence, so we can find out where this is going? So is it from peers, is it from gangs, is it from parents, for both the settings, Malawi and in South Africa? Thank you.
Thank you. Thanks so much.
Can I just
let's
have
do a
number
next
1
question.
and then, you know.
Morning, and thank you.
My question is for Gabriella. Thank you for that very informative, and congratulations on your master's. I've got 2 questions. With regards to your study, I wanted to find out if you collected any data on the mental health status of your participants, just due to the synergistic relationship between mental health and substance use, and the effect that could have on your outcomes. And if you did an analysis on that, what that showed you. And then I also wanted to ask if any of your participants were on any form of PrEP, just to see what effect that substance use, for example, would have on the PrEP uptake and adherence, and your potential outcomes, one of which is HIV. Thank you.
Let's respond, and then we'll go to number 3.
So we are actually collecting data on who is victimizing these participants. So when we do ask them about their experiences of violence, the follow-up is, who did this to you? You mentioned that you were hit, you know, who was this? And we allow space for various types of partners and peers in the community as well. The study is also a massive study. This is just a snapshot of one of the elements that we're using, but we do have an in-depth questionnaire that they fill out before and after. And some of the questions we are also, or data that we are capturing, is what are the reasons they perpetrated? So why did they feel the need to physically lash out at that participant? And we're trying to get a sense of, you know, there's some indicators of self-defense that came out, or power dynamics within the relationship. So that will be very interesting going forward to see what kind of data we get out of that. I don't know in Malawi.
Yeah, Malawi, we don't capture that quite as well. The scale that we use, the Adverse Childhood Experiences International Questionnaire, was developed by the WHO, and is much more inclusive of different kinds of violence along, you know, ecological levels, the individual, the family, the peers, the community, than a lot of tools before it. And so I can tell you whether experienced a lot of peer violence or a lot of abuse at home, or it was witnessing domestic violence that was important. But I can't say, if they experienced, physical violence in the home. I can't tell you who was the perpetrator in that study to that detail.
Okay. Number 3.
Hi, thank you for your wonderful question. So the mental health question was a really great question, and we actually did consider looking at that because it was a variable that was collected in the study. And other syndemic frameworks have included mental health, but we ended up deciding to just stick with the SAVA syndemic framework, which does not include mental health. So we ended up excluding that from our analysis. I think moving forward, that would be a really important factor to include, and I definitely think that it has a relationship within that model and within that relationship. And then regarding the PrEP, so the overall study aim was to connect participants to services, and a part of connecting participants to services was connecting them to PrEP. So participants were on PrEP. We didn't look at the association between being on PrEP and substance use, but I also think that could be a potentially interesting study to look at that.
I think Thank you very much. Sorry about that. Thank you very much. My name is Siami Sang. I'm from Botswana. I would like to thank all the presenters for the wonderful presentations. I have two questions for Candice. First of all, thank you for this very interesting presentation. I think one of the things you mentioned was that one of your hypotheses was that the HIV positive adolescents would be more likely to experience or perpetrate violence, but you didn't see any association in your findings so far. I just wanted to get from you, what do you think would be the explanation for this in your cohort? Is it because it's just preliminary data? Do you expect to see an association as you do more analysis, as you collect more data? The other question which is related to that is, when you analyze by, say, frequency of these events, do you see any sort of like association between, say, multiple acts of violence or multiple experiences of violence and perinatal HIV, or there's still no association when there's multiple instances? Thank you very much.
Thank you. And maybe, Rachel, I can ask, given the information that has been shared this morning from the 3 different presentations, but particularly around this violence, how do you think this ties into our theme around SDGs? The findings from the Malawi work and the Soweto work, how does that relate to SDGs? And do you think these results would be generalizable and seen in similar other sub-Saharan settings with high HIV incidence?
Okay. So, as I mentioned, we did expect a difference in these violence experiences. And we had a really great discussion with our team as to why we are not seeing that. And one of the thoughts that we had is that we had recruited our sample from adolescents who were seeking care at HIV care clinics. So they do represent a particular type of person. They are taking some of their medications. There's protective factors. And the fact that they had survived through their adolescence to 19 years old also indicates that there are some protective factors within their childhood, right? Or that they are being taken care of. So we wondered if that was one of the possible ways in which they were protected, and we didn't see that difference between the negatives and the positives. Then you also asked about multiple experiences. I'm going to refer to Rachel because she did a lot of the statistics and running these preliminary analysis. So I hope you can carry.
I haven't yet looked at that, but I will. Thank you, though, for that comment. We are still in the process, as Candice mentioned, and so this is just a quick snapshot because we were really excited about the results. And then to link some of this back to the SDGs, there are SDGs, as people have mentioned, about health, include HIV. There are SDGs that focus on eliminating gender-based violence, and I think that gender-based violence is part of the conversation when it comes to HIV and has been now for quite some time. But there are also SDGs that relate to violence against children, and I think that has to be more of the conversation here. And those are all interrelated, and I think that's important to recognize. Households where there is violence against a woman, there's often violence against a child. And children who experience violence go on to perpetrate violence much more often. So these three concepts are really interrelated, and I don't think we're going to make progress or as much progress as we need to unless we look at these structural determinants. And so all of them are important. In terms of whether or not I think these findings would hold up in other countries, every context is quite different. And that's why it's so important to have this work done in low and middle income countries and not just say what's happening, in the US or in Europe would be the same sort of phenomena happening somewhere else. So we've done these studies in Malawi, we've done them in South Africa now, and as Candice mentioned, the mobile surveys are just one part of the larger study. We've also collected this in-depth information on adverse childhood experiences over a couple different studies in South Africa, and we found really high rates there too. And also, in that population, we see that these childhood adversities are linked to sexual behavior in both the HIV negative and the HIV positive cohort. So we're seeing the same pattern sort of repeated across different populations.
Right. Well, thank you to Rachel, Candice, and Gabriella. And I really liked the session that it had experiences from Sub-Saharan Africa as well as the US, and you being able to come and present those findings. We're out of time, and we'll be going on a break soon, but I think we're going to call up on the junior mayor and the deputy junior mayor. We really thank you for making the time to spend the last 1.5 days with us. They'll be breaking off and attending to other civic important duties. So we're going to ask them to come up and just bid their farewell. And then I'll ask Damaris to come and give us next steps in terms of what we'll do after break. We're breaking out into the breakout sessions. So first, maybe to the junior mayor and the deputy to just bid us farewell.
Hello and good morning, everyone. I think that I will do the rather informal greetings and Leo will do the more formal one. I just want to say how thankful we were to come here and to experience so many diverse people in the room from all over, getting the, how can I say, okay, let me just say experience, just to see how everyone interacts. Everyone was so friendly, they were so nice and sweet. It was really welcoming for me, and I am from Cape Town, and we were supposed to be the warm, welcoming ones. So it was a real joy to see everybody come together, especially after COVID. I know that the last HIV and Adolescents conference was in 2019, if I'm right. Yes. So just thank you once again, and I hope that when you guys do come to Cape Town, and then our successes will be, they'll hopefully live up to the standards which you guys set out for us. Thank you.
Good morning, everybody. No. Morning, everybody. Morning. Come on, we're leaving now. This is our last session with you guys. I just wanted to say thank you for the knowledge that you've given us also that we can take back to our counselors, our junior counselors, and we do touch base on everything that you guys have spoke about, but obviously not in the depth that you guys have shared with us. So I want to say thank you for the knowledge, and I have spoken to quite a few, well, myself and the deputy mayor have spoken to quite a few people where we ask for their business cards, because in council we speak about mental health and we speak about HIV and AIDS, but we don't understand the root cause of it. And it's not that we lack understanding or we lack the knowledge, it's that we never shared. People don't come to us, we need to go to people. So I want to say thank you for once again putting the youth and giving the youth an opportunity to speak. And I'll say this forever, that the closer you look, the less you will see. So thank you once again, and it was an honor and a privilege to be here. Diabong.
So thank you once again for making the time to be with us, and Damaris and Jeremy.
Good. No. We are not dancing, so don't run away or be shy. So we're just here, me and my able co-chair, co-moderator. We're here to introduce the next session, which will be taking place after tea break. So we hope that you'll take your coffees and teas and snacks on good time so that we start our next session on time. So Nikki.
Okay, so hi everyone. Just would like to quickly inform about the skill building sessions. This will not just be a regular lecture, it will be interactive. And we promise that it will be an exciting experience for you. And we, the organizing committee, have curated the best facilitators. They are all experts from their field. And we hope that these sessions will promote cross-learning, and not just from the facilitators, but we learn from each other. So out of the 5, we have a session about differentiated service delivery that will take place in room Queens 1, that is right across this main room. From the International AIDS Society team from Geneva, Switzerland. The differentiated service delivery is a method that promotes a client-centered approach, which simplifies and adapts HIV services across the cascade from testing to treatment. So we also have a session about Uproot Scorecard, youth and community accountability that will take place in room Queens 2. That's also right across this room. From the team of Zimbabwe Young Positives. Uproot Scorecard is a youth-led monitoring tool to measure progress on key issues that impact young people in the context of HIV. We also have, I'm speaking like long. So we also have a session about social media. Social media and our voices engaging young people. That will take place in room called Harlem. That is on the left-hand side of this main room. From the team of Y Plus Global, it's a session about social media and how to build your knowledge and technique on advocacy and social media engagement. The last 2, please, Demar's.
Thank you. The last 2 are also interesting, and I know one of the facilitators said there's going to be a dance, but I don't want everyone to go there. So we need to distribute ourselves. The next session is implementation science, which is going to take place in the main meeting room. So we'll need to give them space. Then the other session is bring your own data, data refined HIV and health programming for adolescents and young people, which will take place in the pizza room that is on the ground, the mezzanine floor. So kindly, I wish you all the best. After that, we'll be coming back here for our next session. So looking forward to seeing you guys. Thank you. Enjoy your breakfast.